Hi, everyone, and welcome to the next instalment of the Careers Based podcast. The ideas of these podcasts is to give you a bit of an insight into different roles within the business. It might be a particular area of the business that you're keen to move into, or you might just be interested in learning a little bit more about that area of the business. Today, we've been joined by two members of our oncology team. So we've got Gary Griffin and Holly Horner. So welcome both, and thank you for your time today. I do appreciate it. Um, Gary, should we come to you first? You want to give us a little bit of an introduction?
Yeah, thank you, Grace. So my name's Gary Griffin. I'm one of three managers on the oncology team, and I've been at Bupa now probably for about 16 years,
Mm-hmm.
and worked my way through quite a lot of the different specialist teams.
Yeah.
Spent a bit of time in academy, um, and then came over to oncology,
Mm-hmm.
which I believe has been set up for 12 years now.
Okay. Excellent. It's a long time, and I'm
So
sure
yeah,
has evolved massively during that time.
absolutely, yeah.
And Holly, welcome. Thanks for joining us today. Tell us a little bit about
Thanks.
yourself.
So I'm Holly Horner. I joined Bupa on the 10th of January, to be very specific, of this year, and went straight to oncology from academy in April, and
Mhm.
I've been here since.
Excellent. So you're nearly on your year anniversary, so well done.
Nearly, yeah, we'll have to
Yeah.
celebrate, won't we,
We'll
Gary?
definitely have to
Yeah.
celebrate, yeah, in January. So Gary, you kind of gave us a little bit of an insight into the background of the oncology team there. Can
Yeah.
you, so obviously it's been around for quite a while. How big is
Mm.
the team, the overall team? So I know you'll be one of multiple managers in that area. Give us a little bit of idea about the setup.
Yeah, so I'd say there's probably about 36 advisors on the
Hmm.
team, and there's three managers, and then we've got CSM,
Hmm.
currently Renee Gorton,
Yeah.
and the other managers are David Roughton and Neil McEwen as
Hmm.
well. And then what sits on side of the oncology team, we've also got an admin team that are
Yeah.
within the Omni channel who
Okay.
deal with a lot of our medical reports,
Yep.
claims, and other admin as well.
Hmm.
So the whole purpose, the reason why the oncology team was set up is that we felt that members needed quick access to receive the diagnosis and treatment for
Hmm.
cancer related conditions.
Yep.
And there was lots of additional support that we needed to signpost these members. So we felt that a more specialised team who were trained in different types of oncology, and different types of cancer and the
Hmm.
treatment, would be really beneficial to the customer.
Yep.
And we also found that there are a lot of our customers that we talk to are very vulnerable.
Hmm.
So again, we've got some training and some support with our clinicians, our oncology nurses who
Yep.
sit beside us as well and help
Yep.
us, and they teach us how to change our adapt our response to the
Yep.
customers who are more vulnerable, and additional signposting for support as well.
Yeah, and it's always really interesting when you work closely with the clinicians as well, isn't it? Because you kind of pick up a different way of looking at things as well, and pick up some of their knowledge as you go, which is always will be useful for you and I guess the advisors there within the oncology team as well.
Yeah.
Holly, tell us a little bit about the different kind of work streams that come into your team. So obviously you're predominantly telephony based, but in terms of the calls that you might take, what are the variants in the different calls that you might have coming into you?
So we get obviously a lot of different kind of queries coming through. I would say the most common type of call that we get is a new diagnosis call,
Yeah.
which can, be very difficult for both the patient and the advisor. As Gary has mentioned, we do deal with quite a lot of vulnerable customers.
Yeah.
And it's so important on that call to kind of let them know about all the additional support that Bupa can offer under the Cancer Promise,
Hmm.
which is one of the best things I would say about Bupa.
Yeah.
And I think probably the second most common is for me personally anyway, is the breast symptoms call.
Yeah.
So that's usually, so even without a confirmed diagnosis, anyone who's either been referred or has a breast lump, man or woman, will come to us, and we guide them to, either a breast bupa specialist, or one of the specialist centres.
Yeah.
And where they're guaranteed basically an appointment within 2 working days for that
Okay.
diagnostic pathway.
Yeah.
So they're kind of the main calls that we get. Just to touch on kind of what Gary said, we collaborate with a lot of teams almost on a lot of the calls. So the nurses, policy, admin. Cancer is a very unique experience for every individual, and there's a lot of potential side effects and a lot of experimental treatment and drug regimes coming out every day. So there is usually a lot of different streamlines of things that we need to do on almost every call.
Yeah. I always think a really great tool that we have for our customers is the direct access pathway.
Yeah, definitely.
Yeah, and obviously I'm guessing that's probably one that you deal with multiple times in a day, but it's really useful for us to have, and obviously a great benefit for our customers as well, meaning we can potentially get them through to someone a lot quicker than we might have done before if they needed to wait to see a GP.
Yeah, it's like a one-stop shop. So for somebody who's got something as worrying as a breast lump, they can potentially get to see a consultant, have a mammogram, have the results back, and even get a biopsy on the same day.
Yeah.
So it's really reassuring, and to be honest, that is where we're spending a lot of our time at the moment. We're opening and working new pathways. So we've done really well with the breast pathway. We've just started working on the bowel pathway. There's quite a few hospitals now that have got specialist bowel centres. And then in the new year, we'll be focusing on a prostate pathway as well. So yeah, that's kind of what we're driving forward at the moment.
Yeah, and do we know why specifically those types of cancers have been? We're focusing on those types of cancers initially.
We get the most calls about them,
Yeah.
and we hear that our members are more concerned about getting a quicker diagnosis for things like a breast lump or prostate problems or bowel problems.
Yeah. Excellent. That sounds really exciting. You've check in with me in a bit, Gary, and let me know how you get on with that. Holly, can you give us a bit of an insight into what a day in the life of an oncology advisor looks like? And I get that it'll probably be very varied day to day, but more generally speaking, what does that look like for you?
Yeah, exactly. I mean, as I've mentioned, they're the most kind of common types of calls that we get, and it can really vary from day to day. We do get some tough queries through. As I said, a lot of side effects, a lot of drug regimes, like something that we do almost every day, several times, is for the follow-ups. I'm sure you know that the bupa policies don't usually cover for monitoring, but under the Cancer Promise, we will cover for someone's monitoring until they're discharged from the consultant's care. I remember when I started in academy, one of the initial things I actually said was that I didn't want to work in oncology because I just thought it'd be so overwhelming. And especially as for someone who's kind of had cancer in the family before, I didn't think I'd be the right person for that role. But I thought, you know what, I'll give it a go. And, it does really develop you as a person. It's not just a role where you can learn to be a great frontline advisor, but it does teach you how to be compassionate, patient, understanding, and also sometimes build quite thick skin. It can be a difficult time for those who are, undergoing treatment, new diagnosis, and you just have to remind yourself that it's never anything personal if they're not responding in the way that you used to. We constantly just have to offer that additional support that's available. And remember, it's important to be the person that you feel like they need to be on the other end of that
Yep.
phone. Not
Yep.
everyone wants, a chat and that support. They just want the authorization, and that's absolutely fine. Like, it's such a dynamic role, and I think that's one of the things that I enjoy about it the most, to be honest.
Yeah. So what would you maybe say to someone that's maybe one of our newer members of staff and in academy and thinking about joining the oncology team? If you obviously can put yourself in that circumstance and you weren't 100% on it. So what would you say to someone that's maybe feeling similarly to how you were?
I'd just say give it a go. If it's not your thing, that's absolutely fine. The thing that really helped me was the team itself. We're quite close knit. There's always someone there to answer a question, whether that be, the advisors or the nurses, or the managers, of course,
Yep.
Gaz. There's always someone there to help you. And if you've had quite a tough call, there's always someone there to boost you up
Yep.
or talk you through it. And I'd say it's been an absolute great experience for me, and couldn't ask for more at my first year at Bupa.
Amazing. So I'm going to come to both of you with the next question, if that's okay. Gary, I'll probably start with you. How would you say you believe the oncology team contributes towards making the elephant run?
I would say definitely they're so hard working and versatile in their role, but the main thing is just making sure that we're getting our members quick access to a diagnosis. And they do that by speaking to a number of different types of customer, that they'll engage providers, consultants. They often speak to care support, out of network team, the nurses, because they need to discuss the treatment against the NICE guidelines and things like that. So yeah, that's how we would contribute, I think.
Yeah, thank you. And then for you, Holly, how do you kind of feel about that? How do you think you're contributing towards the success of the company?
Right, so I've broke it down into the
Go for it.
3x6 strategy.
Love it.
So
Go for
I was
it.
actually, Gary knows I love my development. So I was actually listening to a podcast that Iñaki did where he talks about the strategy. So there's the 40, 60 and the 80. So the 40% of that strategy is the percentage of medical activity that we deliver to customers. And that happened under Bupa. And as Gary's already said, the number of people using the policy instead of the NHS at the moment for a diagnosis or for treatment is increasing. And we can just see that, with the call queues and the amount of new diagnosis calls that we're getting. And I think especially with the specialist centres that we have on offer, that's going to massively contribute to that 40% in a big way. The second, so the 60% of the strategy is the percentage of customers who interact digitally with us. And I think there are still processes being put in place to help with that in oncology. And I do know that the eForms teams do often direct members to actually call us directly, but that's usually due to the complexity of cancer and things like that. But I know that the Omni team operate a really efficient way of communicating with members. And I think a massive thing is COVID's caused like a lot of isolation and loneliness for people. And I think having someone on the end of the phone who someone can actually speak to will always be a necessity for a lot of people going through this. And I think that aspect of our team will always be needed in some respect. And then lastly, the 80% is the growth in general. And I think the cancer promise is the main selling point of a lot of policies. And I think the way the diagnosis rates are increasing and that that massively will contribute towards that growth and that customer engagement. And lead to a lot of development opportunities and kind of business opportunities as well.
Yeah, fab, thank you. And extra points for you for doing your homework.
Always.
I like
Thank
it. So again, I'll come out to both of you and again, maybe Gary, start with you first, but what particular skills do you feel that it would be really useful for someone to have if they were to be joining the oncology team?
Yeah, so it's a fast-paced, challenging environment, although really rewarding. So I would say that someone has to have great communication skills. They have to show hard work and determination and probably resilience as well.
Yeah, excellent. And Holly, I'm guessing you'd agree with those. Is there any additional ones that you'd want to add in there?
Definitely. Probably empathy. But as Gary said, resilience. So, we can't say yes to everything. And some of the kind of decline in treatment can be difficult. But it's like, as I said, it's dynamic. There's something for everyone.
Yeah. Excellent. And from the sounds of it, and obviously I know of the oncology team anyway, but you do an amazing job day in, day out. So thank you.
Thank you
for that. That is the end of my questions. We've obviously covered quite a lot of information. Is there anything that either of you kind of want to add that we've maybe missed by just going through the questions that we had that you want anyone to be aware of in terms of oncology?
I would just say it's really important to try and understand what calls come into our area, because that time that we spend with the customer is really precious in signposting that support or the urgency of the matter. So for me, it's really important for you to try and understand the type of calls that we deal with, and only transfer if you're 100% sure it needs to be in the oncology team. And lastly, I'd say come and see us. Come and spend some time with us and listen to some calls. We'd love to see you and tell you more about the role.
Excellent. And can we say that we can direct to you, Gary, for that if anyone's interested?
Definitely.
Perfect. Well, again, thank you both for your time. I know it's really busy, and I do appreciate you taking time out of your day to come and speak to me. Excellent. Thank you so much. Take care.
Thanks,
Thank
Grace.
You.
Bye.
Bye.
Bye.